Okay, so welcome, and my name is Dr. Margaret Emerson, and unfortunately I wasn't able to get my presentation to be without the notes, so I apologize if that adjusts your screen a little bit, but we are going to be talking about mental health app evaluation, and our focus really is to kind of help folks be able to get an update with the APA framework for mobile apps, as well as describe some of what we've been doing with the novel approaches as to how the mobile apps are being used in research and clinical care. And so it's my pleasure to be able to present with myself and colleagues, so Dr. Sonia Matwin, Dr. David Bratson, and Dr. Stephen Chan, all of which who will familiarize you with their institutions and what their expertise is. But I am located in the University of Nebraska Medical Center here in Nebraska, and I am a nurse practitioner by trade, psychiatrically trained, and then work here as an assistant professor. So, all right. So objectives really for this presentation are to be able to really familiarize yourselves with the 5 stages of the APA app evaluation model, be able to understand some of the risks and benefits associated with using mobile apps, and then also really just have some availability to understand what the resources are that are out there to help individuals use apps and understand some of that role that we can have in using apps for care. And so one of the first things I think that, us as a panel really wanted to kind of talk about was why evaluate apps in the first place. And so there are several reasons why we really need to evaluate apps. Just like anything, technology is no different in terms of it is constantly changing, adding new features, and just regularly creating some obstacles in terms of, just really trying to be able to keep up. And the importance of really understanding that is that sometimes apps are not regularly updated. They're collecting data that may not be encrypted or protected in the way that we want to, exposing ourselves, consumers, and users to different risks. And so oftentimes what happens if you don't actually do a thorough evaluation of an app, what happens is that you're exposing yourself or consumers or users to particular risks, or not really understanding the full benefits that an app can really offer. The other reason why, we think it's important to kind of consider the need to have a framework to evaluate an app is that some of the availability of the top 10 lists and the hierarchical frameworks that are used to, that patients and consumers find apps are not derived from the evidence or clinical utility in practice. Rather, oftentimes they stem from what's widely available or popular, or sometimes have a financial incentive for people to pay to have their reviews completed. So it's important to kind of understand when patients are coming to clinics with these apps, or we're looking for apps to use, that some of what's available out there isn't always vetted in the same way that other interventions are that we use in clinical practice. And we know that apps really need to fit the consumer and really preferences for their use. So it's not until you really get into the apps that you really can start to see what they have to offer, what maybe some of the limitations are, and if the overall app purpose is really going to fit what you're really hoping to achieve with it. And so there are several tools and resources, and the list that I'm going to give you is not going to be exhaustive, but that help us explore some of the apps and evaluate them. And some of these include the mobile app rating scale, the mHealth app usability questionnaire, in addition to the APA mobile app evaluation tool, which will really be the primary focus of our conversation today. There are some differences in the app evaluation tools, some of which is primarily involving with how they communicate the results. So some tools will provide a static score, where others will provide more of a detailed narrative. And so just things to kind of consider when we're thinking about providing a static score, it may not direct in individuals, whoever's doing the evaluation, to specific features that an app may have, or capture things that we may want to see that we would capture in sort of a detailed evaluation. And so the APA model provides that detailed narrative with an app evaluation that really captures a lot of the different characteristics that make it a little bit more tangible, I think, than providing just a numerical rating. It's not to say that one is better than the other, it's just a different lens with which we can view these apps. And so there are pros and cons to the different resources that are available. And completing the process for the full evaluation framework takes a bit longer and does require some practice to become more efficient at doing this, and locating where the information can primarily be found within the app, or the resources that are available to support the app sometimes can be a little tricky, which is why part of the presentation today will include Dr. Matwin and Dr. Bratson will kind of go through how to perform some of this app evaluation, because it's not until you see it in practice that you can really kind of put some of those pieces together. But having these narratives is an important way for us to kind of capture what is available in the app and, being able to take that deeper dive. So we are going to talk about the APA framework update. And in order to do so, I felt like it was important for us to understand kind of what the original framework consisted of. And so the original framework really evolved over several years. And the overall goal of the framework really was to offer some guidance and support for making some informed decision making around apps. And it had been widely adopted, given it was pretty broadly applicable. However, the key stakeholders that really were involved in its development really felt like it was important to ensure that the framework really could be even more applicable across different health, mental health fields and across other health populations. And then also that it was representative of diverse perspectives. And so there was an effort to really develop an expert panel to really achieve this purpose. And the app advisory panel, so you'll see that all of the presenters here today were a part of this app advisory panel, and the APA actually put out a call for applications to be a part of this panel, and so they received applications from all over the US and other countries. And what happened is that the final panel consisted of representation from psychiatry, including psychiatrists and nurse practitioners, medical students. We had folks with psychology, social work, informatics, peer specialists, and individuals with lived experience. And so what happened is we met over the course of a couple days and really to update, adapt the framework that was originally developed, and then really leveraging the expertise that everybody had with the regards to how to evaluate an app, and suggesting changes to how the framework could be more comprehensive and user-friendly from a patient perspective, provider perspective, and consumer perspective. And so the result of the meeting ended up that we updated the framework itself, really resulting in a clear line of questioning and descriptions of some of the different levels, that we reorganized some of the material and where it was housed. And then again, we really leveraged that expertise from those different disciplines, and we're able to incorporate some diversity in the perspective of the app evaluation. And then beyond the update to the app evaluation, we were also able to develop the 8-question evaluation model screener that I will share with you before Sonia presents. And this screener really kind of was the product of us all recognizing that it would be great if we had the time to do a full evaluation on every app that we have available. However, in practicality, this is not always the case. And so what are the best things that we can pull from this framework that will really lend itself for us being informed as a provider and a consumer to understand what an app has to offer and when we should maybe be concerned with proceeding with the use of an app. And so on the right side of the screen, you're going to see the list of all the app advisory members in no particular order. And then on the left side of the screen, you see the app as it exists, the app framework as it exists now. And so we changed the background information to now it's access and background. The safety and privacy is now changed to the privacy and security. Evidence was changed to clinical foundation. And then ease of use was changed to usability. And then the interoperability was changed to data integration towards therapeutic goals. And so we're going to focus on each of the levels in the following slides, but it's really important to note that all the levels are really seen in a sequential fashion. And the original framework existed really as a pyramid format, suggesting and really emphasizing that some of those first foundational levels, those level 1, level 2, are really some of the driving factors as to whether or not you would want to proceed beyond that, because they are really important in understanding some of those fundamentals with the app before you start getting into level 3, level 4, level 5. If level 1 and level 2 are questionable, that really suggests the need to maybe move on to a different app, because we've found that that can be problematic for folks. So level one, when we're talking about the background and access, this really is, this section focuses on, is it necessary to complete that full evaluation? Is there enough information here to merit a full review? Not every question needs to be answered in order to proceed with the evaluation, but it really gives you a better sense of what the app has to offer and some of those realistic things that we would want to know. So does the app operate on certain systems that we have available? Is it work on a desktop if a patient maybe doesn't have the availability of having a smartphone? Has it been updated in the last 180 days? I think I've been sort of shocked in doing these processes that how many apps have seen routine, updates over the course of their use, and then all of a sudden it just sort of drops off. So updating on a regular basis, kind of looking at the historical information as well as, present day of what sort of the patterns have been with updating has been very important. Who is the owner of the app, and is that clearly identified? Is it coming from a trusted source, or things that are very important to know? Does the app claim to be medical? I think that is going to play into some of the things that we'll need to know in the future, because that may change our ability to incorporate some of those things into clinical practice. And then, are there hidden costs or additional costs? Sometimes we are not able to really see what the app has to offer until we start getting into the content and seeing if there are features that they've advertised within the app that are no longer available unless you have a subscription, or that they can only be unlocked at certain levels of membership. So those are things that you don't get until you start looking into the app a little bit more so. And then also, the functionality of the app offline is the app still going to be user friendly if they're not within the internet or have the access to Wi-Fi? And accessibility, I think we're all hearing that it's more and more important for us to make sure that the way that we're reviewing information and having information available is accessible for those with impaired vision or disabilities. And so Sonia will go through that process, but it's important to know if those functionalities are enabled with the app or not. And so just kind of at this level, one of the things that we want to make sure, this is an intervention potentially that we're using in clinical practice. So as providers, we want to make sure that we're using information that we're familiar with. And so this is one of those levels that as we go through it, it's important to verify that information. And then, just as that patient perspective of some of the things that are important to address in this level are, identifying if the features that we are all wanting to use in practice and in treatment are going to be available without a cost. So those are just kind of examples of how identifying stuff in this level would be important. And then level two, we start to get into that privacy and security portion of the app. And again, this is that risk assessment where just like any other intervention that we're looking at, we as the clinicians, if we're using this in practice, want to make sure that we understand the liability that maybe we're exposing ourselves to and potentially patients, as well as the risk there and the benefits. So this level looks at if there's a privacy policy, and if there is a privacy policy, is it understandable? Is it transparent? Do we feel like it's, sort of a generic privacy policy that has just kind of been rolled into the app, or is someone taken some time to really be, able to demonstrate clearly what is happening when someone uses this app versus, I think we've all in this app evaluation process that has apps that are available on the APA site. We have seen a variety of ways that privacy policies have been presented, some of which are generic, some of which are completely difficult to understand. They have all kinds of legal jargon, but unfortunately that lends itself to the risk of signing people up for sharing all kinds of information that they're using on their phone without having that knowledge if we're not clearly looking into those policies. This section also looks at some of the data that's being collected in terms of, is the data being de-identified? Does the consumer or the user have the opportunity to delete the data or opt out of the data? What security measures is the app using to protect any data that's being collected in there? Is the app are you giving permission to share the information, the data that's being collected with third parties? Does the app have a means to respond to any potential harms or safety concerns? And we specifically have looked into this with some of the apps that we've done. If someone indicates sort of a self-harm or suicide or, safety risk, is there something built into this app that's going to deliver what we would consider, appropriate sort of response to that, like listing emergency numbers or, triggering some other sequential response in related to harm. So you would be surprised at how many times that this does not happen, or that the numbers or resources that are available in there are not actually accurate, or they're outdated. And so those are things like as a clinician that we would want to know. The other things that this app, this section looks at are, does it use cookies? And then does the data stay on the device or is it sent to the developer? So that's kind of that covering of that privacy and security. So level 1 and level 2 are big things to make sure are well developed and everyone understands kind of what you're getting into when you get into those, when you're using an app, and making sure that fundamentally it's going to be safe to use it. And then when we start to get into level 3, we're looking at some of that clinical foundation. And so unfortunately, I think we're going to get more data on some of the effectiveness and efficacy with some of the apps, but a lot of apps are claiming to be beneficial, and very few of them really have that clinical evidence to support that. So a lot of, claims that are undocumented. And so it's important when we're thinking about this and when patients are bringing apps to us that we take some time to really evaluate if the apps have the information and the content is valid, either from exploring it individually or by looking to see what has been explored in the literature. And so it would be great if everything had this randomized controlled study for each of the apps. So we clearly know that that's not the case. So what we do in this level is look at, when we're looking at the app, does it do what it's claiming to do? Does it seem to have this foundational reference? Are there use cases that we can locate? Is there evidence of specific benefit, either coming from academic institutions, which would be great, or if there have been publications or end user feedback or research studies that have been done, and what is that information really relaying to the users about efficacy or effectiveness? Who, in terms of like the developers and who's been collaborating with this, does it make sense for some of their degrees and expertise to be someone that would collaborate on some of those things, are also things that we look for. And then has there been any attempts to validate some of the feasibility of using the apps, as well as the clinical recovery and foundation? Is it really relevant to what we're supporting, what we're hoping to use the app for? So it looks at all those things that I think as clinicians we'd like to have, but unfortunately sometimes we're not able to get as much robust information as we'd like for individual apps. So in some ways, it's a little bit more challenging for us to gather all the things that tell us this is exactly what the app will do, and it's been supported by a robust amount of evidence. I hope that as we continue to have people explore this field, that we're going to have more efficacy studies out there, but it's just going to take a little bit of time for that to happen, I think. Level 4, this is where we're getting into the main engagement styles of an app. So does the app and its features really align with the patient's needs or your needs and priorities? Is there ability for us to make it customizable? And does the app clearly define some of the scope of the functionality? And then does the app seem easy to use? So this section is a little bit more subjective, because different people will have different impressions of the functionality and the ease of use. But it's important, I think any of us that are in this field at this point realize that engagement and sustained engagement with the apps is very difficult. So if there are difficulties with feeling like the engagement right from the onset with the app is creating some problems, then certainly it's probably a time to maybe look at a different app, because more than likely that's probably going to play into already some issues that we have with sustained use. And then again, this is looking at that accessibility. If you have somebody that has some impaired vision or other disabilities, is it going to make sense for us to recommend an app that doesn't really enable some of those features within the usability sense of it? And then the last level is this data integration towards the therapeutic goals. And so when we're looking at this, we're really talking about how does that app handles the data and how it affects, whether there's some clinical relevance to it. So is it accessible to the user in a way that really can be communicated within the care? Can we export that information into the electronic health record? I think that, the interoperability of some of these things is happening, but it's, few and far between in comparison to, I think, what we would like. And if we aren't able to incorporate in the electronic health record, is there a way that the data can be printed or shared with our providers or others so it makes it a little bit more meaningful and valuable versus just being collected in the app and not really being able to use it? So that provides some meaning for using, this patient taking the time to use some of these app features and actually integrating them into care. Is that possible? So that's really what this level is looking at. And other questions that we cover in here are if the individual owns their own data, the ease of use, that interoperability. And then also looking at, does the app lead to any positive behavior change or skill acquisition? So, it may be that an app doesn't have a lot of efficacious, literature out there, but there are some things within the app that are really promoting progress towards goals. And so that is something, or there's development of skills. And so that may be the prime reason that people are using the app. And so we should be supportive of those things and understanding why it is that maybe that app does that in comparison to others. And then also when we're thinking about this in clinical practice, looking at how the app really does it help with the therapeutic alliance with the patient and the provider versus being another thing that we ask patients to do and we're really not incorporating it into care, or it's time consuming in a way that takes away from the focus of the treatment. So overall, clearly there are risks and benefits associated with the use of apps. So we know that apps can be used to augment care. They really can provide some resources that are readily available for a majority of the patients that have smartphones at this point, and they can provide a lot of support and tools. However, they have the opportunity to be harmful, and I think those of us that, again, that are working in this field have seen, a variety of these different examples, but offering different or incorrect information or misleading patients. They also, saying that they have emergency supports built in that are inaccurate or wrong, claiming to offer therapeutic interventions or services that are not effective, and then not being secure or protecting our data in any way. And so really creating an opportunity for us to be at risk in that way. And then actually collecting information that's not really being actionable is, sometimes can be a problematic. And then, we're all working to, at least in our group, use apps in clinical care and how to incorporate some of that. And so there are challenges to still address. And I think there are pros and cons to some of this, but as we continue to understand, how to use the framework, how to identify really good apps and consistently utilize those things, we will continue to explore some of the evidence in the literature and doing our studies to kind of promote this. So I wanted to provide you with the evaluation model screener. So these are just the questions that we kind of as a group decided that these are the things that we would absolutely want to know if we're incorporating them into clinical practice. Again, it's those tangible things like, does the app work on a particular device that the patient has? Has the app been regularly updated? And I would look at that historical information on there too. Is there a privacy policy that's clear, accessible, you understand it, everybody knows kind of what they're signing up for? The data collection, does it mention that? How is it handled? The security features are important, that something is being protected there and they have mechanisms that they've talked about. Evidence of benefit, does it mention any of that? If so, what does it kind of look like? Again, that's kind of looking at some of that trust and the sources of information. And then that clinical foundation being matched to intended use. Do you have enough familiarity with the app to know that it's going to be helpful for you to incorporate into the care with the patient? Does it seem like you're going to be able to use it easily with the patient? Are they going to be able to use it easily? And is that information that's being collected and the app use is going to be meaningful in the way that, we can interpret it and share the data across the patient and with the provider. So that kind of gets the meat and potatoes of what the evaluation model screener does. And it is, I think, a very useful tool, especially in clinical practice.